Welcome and thanks for joining us. My guest today is Oleg Tarkovsky, the Director of Behavioral Health Services at CareFirst BlueCross BlueShield. And we're going to talk about something that's so important and something that's in the news so often, which is behavioral health, which is what you specialize in over there at CareFirst BlueCross BlueShield. And we want to really get to know what the whole situation is in the DC area when it comes to behavioral health. So if you could describe and give us an overview of the state of behavioral health in the national capital area, how would you describe it?
So before I describe the state of behavioral health, I think it's important to define what we mean by the words behavioral health. Often we use those words along with mental health, mental illness, somewhat interchangeably.
Right.
And so I think it's important to give some definition to those terms. Think of behavioral health as an umbrella term, which encompasses both mental health and mental illness. Mental health is something every one of us has to some degree or another. It's our ability to deal with day-to-day ups and downs, and ultimately for most people, the ability to persevere through tough times.
Sure.
Mental illness, on the other hand, is a set of diagnostic criteria for which you can get diagnosed with a mental disorder. And so mental disorder, mental illness, sometimes used interchangeably, things like major depressive disorder, schizophrenia, bipolar disorder, those are mental disorders. And so when we talk about today, this umbrella topic of behavioral health, we'll talk a little bit about mental health and a little bit about mental illness. And
Absolutely.
So when it comes to the state of behavioral health in this area, I think the state of behavioral health is fairly strong. Despite of what we often see on the news, read in newspapers, most people, most of the time, are doing fairly well.
And that's what I was alluding to. Many times we hear negative things about behavioral health, but as you said, perhaps maybe those are exaggerated a little bit, right?
Often they are, because often what we see in the news and read in newspapers are extreme cases. These are sometimes anomalies, and often behavioral health professionals are looking for patterns. Just like in order to diagnose most mental illnesses, we're not just looking for one or two symptoms. We're looking for these symptoms to occur over certain periods of time. So for example, frequency, how often do these symptoms occur? Duration, how long do they last? And the impairment they produce in your daily functioning. And so similarly, it's a good way to kind of think about your own mental health most of the time.
Right.
If you're able to wake up in the morning, fulfill the obligations of your role every day, whether you're a parent, at work, at school, most people are doing relatively well.
And when you talk about behavioral health, mental health, there is a difference here in terms of someone being in, let's say, a mental health crisis and someone just going through therapy because they need to talk through something or get some help with issues they're having on an ongoing basis. So you have the acute part of that whole behavioral mental health, and then I suppose you could call it the preventative part, the ongoing therapy, things of that nature, correct? There are kind of two different things you're talking about.
They are,
Yeah.
although the same person or people can go through these phases interchangeably. So someone who has a mild to moderate diagnosis of a mental illness could have their symptoms escalate depending on what's happening in their life, and sometimes there's really not a specific trigger. So for example, for most folks with major depressive disorder, we don't really know what causes the escalation in the symptoms, but they could be in crisis. Somebody could become homicidal, needing immediate, urgent attention.
And when we talk about things like this, are we seeing any contributing factors when it comes to mental and behavioral health recently, just in recent memory? What do you think? Have you been seeing anything that contributes to the state of mental and behavioral health?
For sure. So when we look at contributing factors, obviously it's very complicated and there's lots of factors, but because human beings are social animal, a lot of what's happening in our society can often be viewed as a contributing factor. So for example, the term is used, social determinants of health. These are things outside of your immediate causal factors like genetics, environment, and rather what's happening in your immediate surrounding when it comes to other people in your life, your family, your coworkers, your friends. And so what you see on TV often does influence your own day-to-day life. And so in some ways, you almost can think of it as contagious. So human emotions are contagious in some way. And so when most people around you are feeling down, you can't help but be sucked into that emotion.
That's a good reason to be nicer to people, right?
Of course, of course. I often use the phrase, the platinum rule. So we're often taught from very young age to follow the golden rule. And if you remember the golden rule, right, treating others the way you'd want to be treated. The problem is not everybody wants to be treated the same way. And so in order for us to be kind to other people, you first have to understand them to see how they would want to be treated. And so the platinum rule is a slight shift to the golden rule, which is treat other people the way they would want to be treated.
And that's a great piece of advice there, absolutely. When we talk about mental and behavioral health and these issues, do you see barriers to getting help with your mental and behavioral health? Are there any things that you can point to that people, especially in the national capital area, need to overcome in order to get the assistance they need, get the help they need, therapy they need, whatever you may call it? Are there barriers in place that you'd like to help remove? Or
Of course, of course. Fortunately or not, these barriers exist in every area. So sometimes geography can point to more pronounced barriers. So for example, if you're living in a very rural area where there's not great access to behavioral health providers, so it might take a little longer to get that appointment, to get an evaluation. In this area, that typically is not an issue. For most folks, most of the time, they can get great access to well-trained behavioral health providers. And if not, they can use the urgent care system to at least start to receive the evaluation and then get their way over to a trained behavioral health provider. Probably two of the greatest barriers today still are, one is stigma, this idea that in some way, when we think about ourselves and our own mental health, and we believe that our mental health is less than, we do not want other people to know that because it makes us feel weak, it makes us feel in some way judged, and nobody really likes that. And so that typically stands in the way. It used to be, there's different kinds of stigma, so it used to be social stigma was a big deal. Today, I think most of our society has come to grips with that, and we accept people's need to get their mental health addressed, especially if they have a diagnosable illness. And we try to treat it no different than physical illness like diabetes or hypertension. Right. And so that part of the stigma, I believe, has gotten significantly better, especially since the pandemic started. But that individual stigma where the person sort of judges themselves as being less than is still around.
Somewhere along the line, like you said, there was a difference in the social back and forth that we all have. There was a difference established where someone says, oh, I have a physical ailment, I need treatment, and everyone just says, oh, okay. And then someone says, oh, I have a mental health issue, I need treatment, and then the stigma comes up. So somewhere along the line, there's really no logic to it, right? Because both are health issues, but one of them has a stigma, whereas the other doesn't necessarily have that stigma.
Believe it or not, this false narrative is over 100 years old. Descartes introduced this problem into our modern knowledge of this, what he called the separation of the body and soul, or body and brain. Today we know, and we even have a name for it, it's called the Cartesian error, because we know that obviously you can't separate the brain from the body, and the whole organism works together. And a lot of modern behavioral health treatment encompasses that new philosophy.
So we talked through some barriers there, mostly about stigma. Maybe there are some other barriers and some other obstacles in place for people who are trying to get mental health and behavioral health treatment. When you think about all of those things, how is CareFirst working to address those barriers?
Yeah, that's a fantastic question. There are obviously other barriers. Equity is a huge barrier. Not everyone, depending on their race, gender, socioeconomic background, can access behavioral health treatment and services in the same way. financially, there are some barriers, whether it's deductibles, co-pays, or lack thereof, depending on whether you have health insurance, whether that health insurance is offered through your employer, all various ways in which barriers could stand in your way from getting the help you need. Transportation even. So if the only therapist you can get an appointment with is 30 minutes away, but you don't have a way to get there, it's going to be really difficult to get there. And so CareFirst has thought about lots of these barriers, and we have tried to make it as easy and as accessible as possible for our members to get high quality behavioral health services, both with this equitable and affordable lens. So for example, we offer our members telehealth appointments, so they can see a provider without ever actually even getting in their car. They can see a psychiatrist, a therapist, a psychologist, using modern televideo technology and getting their needs addressed. There are also several specific populations who need slightly different approach to their treatment. So for example, kids and adolescents, or folks struggling with addiction disorders. And so you need to have specific programs staffed with the right clinicians to be able to address those disorders in those populations. And again, CareFirst over the last several years has been building both the network of those providers as well as different modalities in which our members can access those clinicians.
And we got the 2024 new year. What are some of your priorities, some of the things you're excited about for 2024?
So the field of psychology and psychiatry has been growing rapidly. There's all sorts of new both technologies and revamping old technologies in being able to use to help folks with their both mental health, where almost everyone could use some support with their mental health, as well as addressing mental illnesses, whether it's new medications being developed, new electromagnetic modulation approaches to treating behavioral health disorders, and even some developments in the psychedelic medicines in the space. It will still take a few years for lots of these things to develop, but we're always looking forward in new and progressive ways to address behavioral health conditions. We're also looking to continue doing what we've been doing. A lot of times in this field, it's easy to take your eyes off the ball and things will quickly roll back down the hill. And so we constantly have to be vigilant about keeping up with making sure that all of the services are of high quality, making sure that they're delivered in an equitable way, and as well in an affordable way.
And if someone out there has a question about how to get in touch with CareFirst, maybe they have some ideas of ways they're looking for help, looking to maybe want to get some assistance with mental health or behavioral health, how would you advise them to get in touch with CareFirst?
Probably the best way to get all of your both medical and behavioral health needs addressed is to flip your CareFirst BlueCross BlueShield member card over and dial the 800 number on the back of their card. We have a special 800 number that addresses behavioral health and addiction disorders. That number is staffed 24/7 with licensed clinicians who will be able to, on the spot, do a quick assessment and help folks to get to the right level of care at the right time and something that is the right for them. Because often something that could address one person's need is not the same thing as someone else's. And so we have a team of dedicated professionals that help anyone that calls that 800 number.
All right, very good information. Thank you so much for your time.
My pleasure.
I'd like to thank today's guests, Oleg Tarkovsky, the Director of Behavioral Health Services at CareFirst BlueCross BlueShield. I'm your moderator, Nick Iannelli. For more on this discussion, visit WTOP.com and search CareFirst.